this rapid growth, though, in the recession actually caused some problems in the expansion. One of the things that has been an issue going forward, and a group of providers, including my organization and Residential Services Association, met with the managed care organizations last week, and one of the things that we talked about was the fact that the expansion counties kind of had a different profile than the original 5 pilot counties. And yet the Department of Health Services really is kind of insistent that everybody sort of benchmark against the 5 pilot counties. That different cost profile kind of resulted in the fact that costs began to escalate more rapidly than I think the Department of Health Services expected they would. And so the very first way that they tried to approach that was by going out and training care managers within these managed care organizations to bring care under management. That was kind of the mantra for a while. We're going to bring care under management. The other thing that happened, and this was actually revealed in a meeting, there was a mandate in the 2009-2011 biennium to cut funding for Medicaid services. I think they had to find $650 million in cuts under the Doyle administration, the last part of it. And I asked a direct question to the assistant administrator of long-term care. I said, well, how much of that's actually going to fall in long-term care on these managed care organizations? And she said that family care was probably going to absorb somewhere between 8 and 15% reduction over what they had originally projected. So I think, when you look at the recession, the rapid growth, and sort of, things not kind of being what they thought they were going to be in terms of their projections, that was some of the problems that began to occur. And there were some things that resulted from those cuts and sort of things not being exactly what they thought they should be. And so there was some testimony before the Joint Legislative Audit Committee that revealed several things. One of them was duplication of services. There was some feeling that you didn't need to have a nurse on every care management team because a lot of people were already getting health services in the community, so it seemed like it was a duplicate service. You could say some of the similar things on the employment end of things, that some of the community rehab programs felt that maybe that was a duplication. Of having employment specialists that were kind of out there kind of doing things sort of on their own. Payment rates to service providers were some of the issues that the Joint Legislative Audit Committee heard about. There were multiple conflicting requirements of service providers by different MCOs. Some of the service providers actually, if they're larger corporate entities, they work with several MCOs, and sometimes they hear different things from the different MCOs about how they should be doing things in the same home with the same program. And there were some specific issues for people with intellectual and developmental disabilities, and we're going to get into those a little bit more. In response, the committee did authorize an audit. 3 of the managed care organizations were flagged by the legislative audit as being at risk for financial insolvency, so they were having some pretty severe financial problems. The report said access to long-term care did improve, so that was an accomplishment because a lot of people were taken off the waiting list. But the cost effectiveness and sustainability of the program were difficult to assess. They didn't make specific recommendations. They kind of asked some questions, and they threw it back to the Department of Health Services to answer the questions and come up with some plans to try to make the program more sustainable. One of the things I think is particularly of note is that in the future considerations section of the report, one of the questions they asked was, are rates sufficient to maintain an effective provider network for long-term care services? The report cited some unreasonable rate reductions that were being done. They just couldn't figure out on what basis this particular program would be cut by 30% for a one-to-one supervision rate, that there were delays in service authorizations when somebody had wanted to make a change in their program or kind of came into the program. And they also cited some payment reductions, such as notice that one provider got on October 27, 2010. The rates would be reduced some 3 or 4 days later on November 1st.